Hello and welcome. On behalf of Isolation Block LLC, we would like to thank you for giving us the next few minutes of your time so that we can tell you about our brand new autoclavable isolation products. Our products were introduced into the market in November of 2009. Here you'll see the isolation block is soft and flexible and easy to place in the patient's mouth. It has many features like the bite block, tongue shield, lip retractor, which isolates the teeth in this area, and continuous suction 360 degrees around the working space. Let me introduce you to the inventor and co-owner of Isolation Block LLC, Dr. Logan Coffey. He's here to demonstrate how to place the product in the patient's mouth.
We would like to show you the placement of the isolation block with the single lip retractor first. The single lip retractor comes in 3 sizes to fit most of your patients. It can be used on the maxillary arch or turned over and used on the mandibular arch as well. The easiest way to place the isolation block is just to get a hold of the tongue shield, give it a little bit of a squeeze just to make it a little bit more narrow to get it in the patient's mouth, and then you just have the patient open wide. Then once you have it in place, have the patient bite down slightly on the bite block, and then you just pull the lip up over the lip retractor. Once it's in place, you take the saliva ejector, and it just plugs right into the front and hooks to the low volume evacuator. When you're ready to remove the isolation block, you just have the patient open slightly and it pulls right out. In placing the isolation block on the mandibular arch, you just turn the block over. Same thing, you squeeze the tongue shield, have the patient open. Once you have it back in place, you have the patient bite down slightly and pull the lip out around the lip retractor. The saliva ejector just plugs right into the front again and connects to the low volume suction. And again, as you can see, the patient's just resting on the bite block. The tongue shield keeps the tongue retracted back out of the working area, and the lip retractor keeps the lower lip out off the facials of the teeth. Again, in removing it, you just have the patient open slightly, and the product just slides right out. The placement of the double lip retractor is a little bit more of a mouthful for the patient. Once you have it to place, it's very comfortable. The main use for this product is chairside bleaching procedures, and a lot of the orthodontists like it for placing orthodontic brackets so they can bond both arches at the same time. When placing this, just get a hold of the tongue shield, have the patient open, slide it back to place, and again you just have the patient bite slightly, pull the lips out around the lip retractor on both arches. Open, there you go. And you place the saliva ejector right in front and connect to the low volume suction. To be sure that's off the teeth. Okay, yeah, go ahead and close right there. As you can see, the patient's resting on the bite block. Both arches are exposed. In using this for the chairside bleaching, you still have to place the liquid dam material along the gingiva there. But as you can see, for the orthodontics, the teeth are exposed and for bonding the brackets on. Again, in removal, you just have the patient open slightly, and the block slides right out. As you can see, the isolation block can be used for any procedures where you need isolation from about first molar forward for an extended period of time. In my own personal practice, I don't use the isolation block all day, every day. I mainly use it for procedures that are going to be a little more lengthy in time from premolar forward. I do use it a lot when we're bonding veneers, doing multiple crowns in the anterior, if we're doing multiple class 5 lesions, several anterior composites or bonding. Anything where I need isolation for an extended period of time and that patient's going to have to be open for an extended period of time, it gives the patient something to relax on, makes it a little more comfortable for them, makes my job and my assistant's job easier in keeping the teeth isolated and dry, so we don't have problems with contamination with saliva, and it makes you more efficient, cuts down on the working time itself, and reduces failures as well.
If you have any questions about our products, please visit our website at isolationblock.com. There you will find a video demonstration as well as many other details about our products. You can find our direct contact information under the About Us link and a list of our current distributors under the Distributors link. Thank you again for your time, and we hope you enjoy the use of our isolation products.